Hey guys, welcome back to my YouTube channel. My name is Justin Ship, and this is the palpation that you need to remember for injury assessment class when we're going over the knee and thigh. Okay, so you're going to start with some bony structures. So you're gonna start up here at the hip with the ASIS, anterior superior iliac spine. This is where the sartorius muscle is going to be originating. So you'll need that when we get to the muscular aspect of it. Just below that, about an inch down, you have the AIIS, anterior inferior iliac spine, and that's going to be where the rectus femoris muscle originates. So the major quadricep muscle that it crosses the hip joint and the knee joint. So make sure you can find those two. Other than that, on the side of the hip, right in here, we have the greater trochanter, and we'll need to know that because there's a bursa sac that's on top of that some people have some irritation with. So make sure you can find that one. As far as down the thigh, we'll do a different video for the muscles themselves. But once you get towards the knee, you can feel the epicondyles of the femur on both sides. On the medial side, you have your adductor magnus muscle that's going to be inserting right here. So make sure that you can find this. And then on the lateral side over here, this is what I told you guys yesterday, that the IT band will have some friction over, and one of the injuries you'll have is IT band friction syndrome. So these two structures are relatively easy to find. Other than that, we've got the patella, and I wanted you to be able to find the medial border, lateral border, superior pole, and inferior pole. Just because we'll have our quadricep tendon up here on the superior pole and the patella tendon on the inferior, and we'll talk more about dislocations and stuff a little bit later on with the medial and lateral stuff. You have following down the patella tendon, you've got the tibial tuberosity right here where the patella tendon inserts, and then just medial and lateral to that patella tendon we have the joint line, and we'll talk about some specific structures that are inside of the joint itself. But at the joint line, you can kind of feel this tibial plateau right here, okay? And then once you're on the lateral side, feeling of that tibial plateau over, to the lateral, and then you go inferior, you can feel the head of the fibula right here. Okay, so those are the bony landmarks that you need. If we're talking about the ligaments, we've got the MCL on the medial side. So you find that epicondyle and work your way down to the tibia, and the MCL is just part of that joint capsule, so it's going to be right here on the medial. On the lateral side, you need to be able to find that lateral epicondyle and the head of the fibula, and it's going to be right in between those two, right through there. Now, as far as inside the joint itself, along the joint line here, all the way around, you have the meniscus, and the meniscus is the cartilage that's inside the joint. You can't really palpate that, or the ACL or the PCL that's inside the joint space, but I do want you to be aware that inside the joint capsule as a whole, those structures are located in there. And as far as this quiz goes, that's all I really want you to know. So thank you guys for watching, and be sure to subscribe.